Say somebody is lucky enough to come across this video or one of your videos, and say they're metabolically unhealthy, they're overweight, middle aged, but they haven't gone the conventional route yet, and they want to get assessed properly to see the health of their vessels. What do you recommend?
Thank you so much for asking it. I'm very excited, as in just right now, about that specific issue. You know, when we did the channel, yes, the free content on YouTube was received very well. And as you might imagine, a lot of people started saying, hey, I'd like to come see you. We've actually got a clinic now. We've performed this by telemedicine all over the world. We're licensed in all 50 states. Won't go into the bunny hole and why that happened. But we see a lot of patients for that. But one of the things that's been a recurring problem from day one is insurance is not going to pay for this. Again, a long bunny hole about multiple trials to make that work, including Medicare Advantage. At the end of the day, 1 out of 10 people would call us up would actually say, yeah, I can afford that. Let's go. Let's do that. And most of them would say, gosh, that's just too expensive. I mean, it's always been a couple of $1,000 to get, to get the proper labs, to get started with us, to get stabilized. Sometimes a little bit less, sometimes a little bit more, but I've always wanted something for people that didn't feel they could afford that. And now we have it. We've got a little kit. It's a metabolic evaluation, and you can do it right in your own home. It costs $160. Now, as you know, I know you know a whole lot about this community. You know that some labs, Function Health, different groups are starting to say, here, you can get all of your labs drawn. We will give you a report on them, and you'll know your metabolic situation, your metabolic health. Number one, most of those labs give you a bunch of things like A1C. A1C is important, but I get people all the time. For example, you met Jesus, my partner in the channel. His A1C has always been less than 4, but he's been metabolically unhealthy. He had significant prediabetes. He's one of those people that had a genetic variation in his hemoglobin. If he had not done this testing, he would never have known. 2 of the most important tests on the labs are oral glucose tolerance test with insulin response. Other people, especially your viewers, may have heard of it as the insulin survey, the Kraft insulin survey. Very similar to that. We do in this box a home oral glucose tolerance test. We also look at grip strength, which nobody knows why it's such a good predictor, but it is. We actually get about over 30 different bioindicators of your health. And here's the other thing. As you know, you've got a whole channel on this, over 1,000 videos. Metabolic health is not a simple thing. It can be complicated. You picked up on a couple of nuances very quickly on the discussions you and I were having. People get confused. They need a coach. They need a guide. And even with this $160 box that we've set up with the OGTT and the other stuff, we give the patient or the person, you get an hour of time with that coach to go over the results of your metabolic evaluation, understand your pros, your cons, your strengths, your unique weaknesses or needs, and then to talk about the next steps. So this is such a confusing area. You and I sometimes you may not, but I forget sometimes how confusing this can be. People need help. They need a guide, and that's what you can get. The response to this has been really more than we expected. We've had to back off a little bit on advertising and just keep it mostly to our community. But we're gearing up. We're getting it to where we're able to offer it to more folks.
All right, so testing as part of that kit, You mentioned oral glucose tolerance test with insulin. What other lab work are you doing, or is that it?
So on the routine, on the lab evaluation, one of the things that we add, now this is not in the box because the box is done totally at home, but for folks that want to go deeper and say, yeah, let's go to the lab, we'll also get what we call fractionation. You're familiar with that?
From your work, yes.
Okay. So for your viewers' perspective, fractionation is actually looking at the bell curves, the distribution of HDL and LDL. Now, you might be reacting at first and saying, yeah, but that's cholesterol again. I know HDL and LDL particles carry mostly cholesterol. But when you begin to look at the actual frequencies, the bell curves of each of those two, you get to find out something far more important, and that is triglyceride. And what's important about triglyceride? We go back to that very first thing that you and I were talking about. Too much insulin stops your body's ability to use fats for fuel. And triglyceride, too high a triglyceride level, is one of the outcomes. So some doctors, very few, but some doctors know to look at what we call fractionation. And then you have to use sometimes inside out logics and things like that, but then begin to understand what role is insulin playing in that individual's ability to burn triglycerides, to burn fats. So when you look overall, you step up to 30,000 feet, we have some leading in. We approach this like I did when I was management at Toyota. I was management there for about a decade, and they said at my level, all of us had to get management coaching. And my coach said to me, I know you're a doctor. We see all that, but I tell you, you think like an engineer. And yes, I do think like an engineer. When you get up to the level of saying, what are the best ways to evaluate? We look at leading indicators in an engineering sense. That would be your lifestyle. Then we look at current indicators. That would be things like your fractionation and your OGTT with insulin response. Then we look at result indicators. That would be the CIMT that you brought up, we discussed, and CT angiogram with functional flow reserve, CT angiogram with AI analysis. So that's what we do on a regular basis. Our patients then, as we've discussed a couple of times, it can be very geeky, very detailed, very scientific and nuanced to go through all this. But our patients really develop a comfort level after just a few visits. Hey, I got this. I know what these things are. I know what my unique profile is. I know the buttons I need to push, the dials I need to turn.
Okay, just so I'm clear. So in the kit itself, you can do the OGTT with insulin at home with like a finger prick?
One correction. There is no good home insulin test. I'm blanking on his name. He calls himself the carb addiction doctor. You know who I'm talking about?
Yeah, Rob. He's been on the show. I don't know how to pronounce his last name properly.
Rob
Yeah.
Chappus. So Chappus and our friends, he loves to argue with me about statins. I love to argue with him about stuff too.
Well, bottom line, he likes to argue.
He does. He does. So Rob says he knows that somebody has done it now and it's coming out. That was a year ago. And this has been going on for over 5 years where somebody says, yeah, we got that home insulin test. Bottom line is they don't have it yet. So the test that we have for you at home does include the OGTT. It does not include, you have to go to a lab to get insulin or fractionation. It includes some things that you might not want to do, especially, more female types. Look at body fat. It's got calipers to start doing some pinching and measurements on different places where you're looking for body fat. Some very simple tape measures to start looking at that. Then we start looking at heart rate recovery, genetics, family history. Again, we get it over 35 in the mid 30s in terms of bioindicators to help people begin to understand what means what for them.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
I started as an ER doc. I love doing emergency work, but most of these things coming into the ER should have never happened. High levels of glucose or even high levels of insulin irritate that